Welcome, everyone. Thank you for joining our full disclosure webinar. Today, we are talking about PBM transparency. It is a big buzzword, but we need to make sure we know what data is actually shared and behind all that. So today, we'll be going through information for how you can put transparency into action. And I'm excited to be joined by our guest, Jordan Johnson. Jordan, if you'll introduce yourself.
Thanks, Alyssa. Excited to be here with you and with everybody on the call to talk about data and how to hold your PBM accountable.
Thanks, Jordan. And I'm Alyssa Johnson. I'm a pharmacist by training and lead our clinical strategy team, which builds out our clinical and cost containment drug pathways. To get started, we'll go through what transparency is, how it's touted in the industry, and what it really means to be meaningful in the PBM space. We'll go into why reporting matters, and this is where the data really needs to speak for itself. And then when you get a lot of data, it's important to know how to interpret it. So Jordan will take us through decoding the data, and then what it looks like to have this transparency in action with real savings, and give you a little sneak peek for what's coming for the next webinar. When we go grocery shopping, there are a lot of buzzwords there: healthy, gluten-free, different things that seem like it means that food is healthy. However, without looking at the nutrition label, you don't really know. And so just like looking at the healthy labeling and diving into the data with what's actually listed on the nutrition label, this is where we want to make sure that you're all asking the right questions and getting the data to work with the PBM, where you can truly transparently see your claims and know your data. And that all starts with access. And so while a lot of PBMs claim to be transparent, the only way to really know is in the reporting, which is your data. And these are some examples of what is available from some legacy PBMs where, it's descriptive, it's nice, it's some metrics, but it's not really giving you anything that's actionable or insights to consider as you continue to build out and design your benefit with your vendor partners. And so when we ask for data access, it's also important from an accountability standpoint. Most employers are taking advantage of the programs that PBMs offer, saying that these programs will offer savings. But the reality is that there's still steep year-over-year increases in healthcare costs, and this increase is even exceeding what's forecasted. So even with these programs that are touted, the trend is still higher than expected. And a lot of that is specific to pharmacy spend. 24% of healthcare spend was on pharmacy in 2024. With this rising costs on the pharmacy benefit, it's really important to not take the PBM vendor's word for it that they're targeting these increasing trends in spend, but to get the data. Having access to your data can really empower you to make better decisions. And importantly, about a third of employers still can't get complete data. So the first thing you want to do is ask what data you have access to and if there's any that's missing. Studies show that employers who use transparent PBMs are 1.6 times more likely to report lower premiums. And so it does show that if you're measuring it and seeing these outcomes, it can decrease costs over time. And with the claims access, employers can make sure that they have hands-on strategies to support their employees and better understand what their planned performance is. And when we think about this, we have a lot of clients come over to SmithRx. And Jordan, what is it like for clients who previously didn't have access to much of their data and then to be able to come to SmithRx where everything is open and available?
Yeah, it's a great question because one of the things that happens often is when we share a full claims detail report and they start seeing what the actual costs of a claim was, what the member's copay was, and all of the breakdowns. Yeah, they actually start seeing how the sausage is made. They actually become very surprised, and they want to be able to better understand the process, and they come to us with more questions, and that's what we're here to help answer their questions about the sausage.
It's great. And, you need to just make sure you have confidence in your PBM, specifically as a fiduciary. A lot of those working with transparent PBMs report higher confidence than those using the big three PBMs for this exact reason, to understand what's really going into it all. There's a lot of data here, so the way it's presented in reporting is also really important, as well as the access. And so putting this transparency in practice, we want to give you key takeaways. And so these are 3 pillars to really think about as you work with any vendor, but specifically for PBM, so that you can really understand your drug spend. And so starting with fiduciary alignment, you want to make sure you know what the fees are that are being charged, and be able to track that and have the full visibility. And then, of course, accountability. And this can be applied to any of the partners you work with, but these are the questions you'll want to be asking to make sure that transparency isn't just a buzzword, that it's truly something that your PBM is delivering on. Again, we want to work with them closely, but also there are ways that this is really important for them to stay accountable. As you all know, in the news, there's been a lot of lawsuits, and a lot of these are behind the employers seeing the data, where they see how much their claim costs, and then they see how much lower those claims would have cost had they been able to access the lower cost drug. And so that's really what we want to drive towards here, having fiduciary responsibility to make sure that those lower cost drugs are available and being accessed by your members. And the only way to do this is by measuring PBM performance. In terms of what's at stake with all this, I mean, that's on a broad level, but in looking at a specific claim example, Stelara is a drug that is an autoimmune injectable product given around every 8 to 12 weeks, depending on the indication. It's used for things like Crohn's and ulcerative colitis, psoriasis, or rheumatoid arthritis, and many other autoimmune diseases. It is very expensive for the brand products. Depending on your PBM and the contracts and how much you're getting passed through, it could be between $22,000 to $30,000 per fill. And then the member would be paying their specialty copay. However, with transparency and understanding what products are out there, with a modern PBM, you can see a biosimilar like Otulfi, same active ingredient and approved to be clinically similar and interchangeable by the FDA, is only $1,100 per fill. And through a modern PBM like SmithRx, these programs are set up so that the member also does not have a copay, so that they have no barriers to accessing care. And this is a huge difference. And while you might only have a handful of folks on Stelara, most plans have patients on Stelara or another autoimmune product, and it's a really important class to follow because a lot of biosimilars have been released the last 3 years, and you really want to make sure you have access to the right drug, meaning the lowest cost biosimilar, and can fill it at the lowest cost pharmacy, and also take advantage of any programs available. This is huge because while I know you're all under probably a lot of pressure to make sure costs are contained, it's great to be able to help the organization financially and show your CFO the impact, but also to help your employees stay healthier. And so this is an example of where a member got to save on a very expensive drug, $700 a month. Most people, that would be really impactful and mean that they will be more likely to fill their drug. You have to fill the drug to take the drug. And so we want to improve access, and taking a drug from $700 down to $10 is huge, and something we really want to be able to continue to provide for more products. And so HR really has the power to impact both the organization financially and their employees' health by being selective of the vendors and making sure that you truly can follow your outcomes. And so now to talk more about the actual data available and what transparent data looks like, I'm going to pass it over to Jordan.
Thanks so much, Alyssa. At the end of the day, data is proof. And if you don't have access to your data, how can you hold your PBM accountable? How can you know what's actually happening with your claims? How can you know if your trends are trending in the right direction? That's where engaging your PBM and understanding your data is crucial to controlling not only your costs, but making sure that your members are having the best service possible. So the way that we at SmithRx really view data is all boiled down to one number. And this number is called your per member per month spend. At the end of the day, this is the number that boils down to taking into account not only the sticker price, the cost of a medication, the member's payment, as well as any rebates or any cost containment programs that are baked in. At the end of the day, all of this, what we call our gross plan spend, can be subtracted by the rebates as well as cost containment programs and boiled down to one per member per month number. And the way that you get to that is dividing that net cost by the number of members you have on your plan. And you get down to a number that helps you understand how much am I paying per member per month on my plan. And that's really the number that we hold ourselves accountable to here at SmithRx, because you can't get outside of it. Your discounts, your guarantees, everything else that goes into it can sometimes be a smokescreen, especially on the contract front. So little spoiler for this next future session that we have coming up, to definitely tune in when we talk more about contracts. But at the end of the day, this is the primary cost metric that we help evaluate not only your group and your plan, but against the market. How well are you performing across the industry, and what changes would you need to make to improve that cost containment side of things? Again, it's transparent because not only are you seeing your claims cost, but you're also seeing the cost of your PBM. Any admin fees should be baked into that number as well. So any payments that you make to your PBM or anybody else involved, it would be really helpful to have that number baked in as well. So if we move along, we're going to dig into a little bit more of this PMPM number and how it's broken down. So when you think about PMPM, you have your gross plan pay. Again, so any claims that are on the plan, that goes into your gross plan pay. This is all prior to rebates or any cost containment. Then you add in the admin fees, and here at SmithRx, we just have one flat admin fee for our services. And then you would subtract out any cost containment programs. And we're going to talk a little bit more about our drug pathways program and ensuring that each medication is filled at the right place and the right drug is filled, again, with the correct cost containment measures engaged. So at the end of the day, this gives you your total net PMPM. And you can see in this waterfall here, this is an example of some of the reporting we provide on a regular quarterly basis to our clients that highlights what that gross plan pay was, adding in the core admin fees that we have, as well as any connect cost containment programs, and subtracting out rebates, which gives you your total net per member per month spend. This, again, is the most important number when you're evaluating your pharmacy benefit manager. This is the number that level sets between the industry, other groups your size, as well as the SmithRx book of performance as well. We can provide you some comparisons between the two.
Jordan, when groups come over to SmithRx, how often is this concept of PMPM novel to them?
It's very foreign. It's very, very foreign. The first question that people will often ask is, well, what are my discounts and rebates projected to be? And we say those numbers are important. However, our goal at SmithRx is to drive to the lowest net cost on every drug. And so this per member per month dollar number is very foreign, but it also helps them catch the vision of why the lowest net cost is really important, and not necessarily what was my percent of discounts that I got or what were the forecasted rebates. At the end of the day, if you can source a drug for a fraction of the cost of another branded drug or one that has a higher rebate, we always want to source to the lowest net cost. So this PMPM performance number is really essential in understanding how to hold your PBM accountable. If we move to the next slide, we'll also talk about some other key performance measures to take a look at. Here at Smith, our goal is, again, transparency. We want you to understand all parts that go into making the sausage of the claims. So when we look at performance, we're going to evaluate from not only a PM perspective, but also a cost containment perspective, rebates, and then again, driving down to that lowest net cost. We're also going to show you the number of claims, the member count, so that you can confirm those member totals as well as what the actual PMPM should be. So looking at this next slide, we're going to take a deeper dive into rebates. So a drug manufacturer may kick back $200 on a rebated drug. Now, a legacy PBM may or may not pass on 100% of that rebate for that claim onto the plan sponsor. In some cases, PBMs will actually withhold part of that rebate and keep, in this example, $30, passing on $170 of that rebate. And you may not have the visibility into that, and you may not be aware that your PBM actually got paid $200, and they may have told you that they just passed on $170 of that. So another key component is understanding how much of a rebate was paid out, and did you receive 100% of that rebate? So from the plan sponsor side of that, it's really important to understand that not only are the rebates an important part of the pie, but also how much your PBM is reimbursing the pharmacy where that claim was paid. So if that drug was $100, the PBM may actually have a contract with the pharmacy where we pay the pharmacy $90. And we charge the plan $100 for that. That would be what's called spread pricing, where the PBM would make that $10 spread difference between the two. That is not a practice that SmithRx engages in. We want to make sure that any costs incurred on the plan are passed through 100% to the plan, as well as any savings that's incurred is 100% passed through to the plan. Again, the point of all of this is sourcing at the lowest net cost and passing on transparently 100% of the costs incurred.
Yeah, and I think I just want to amplify what you had mentioned there in terms of takeaways for the group. If you want to turn this slide into questions, you can ask, how much of the rebates do you receive to the PBM, and how much, then compare that to how much is paid to the plan. And then the other opportunity here is to say, how much are you paying the pharmacy versus what are you charging us, to see if there's a difference in those two prices.
So here at SmithRx, again, we want to be transparent. So not only are we going to highlight and share with you how much of rebates have been passed through, we're also going to be able to show you projections into the future. One of the cool features that we have is we're able to project, based on the claims utilization, how that's going to be in the future. And so it helps us project out what the true net cost of your plan spend is going to be. Rebates are always a complex conversation, but at the end of the day, the more data you have, the more informed you are, and the better you're going to be able to understand your incurred costs in the past, as well as where your plan is trending in the future. So when we want to talk about strategy, how do we improve this from a PBM perspective? How do you, as a plan sponsor, drive down your costs and keep those contained? What are the ways that you can leverage your PBM to bring those costs down? So in this next slide, we're going to dig into some of these top plan pay drivers. So when you work with your PBM and you have a quarterly business review, one of the items that we would highly recommend you engage in is better understanding not only what are your top therapeutic areas that you're spending money on, whether that be diabetics or GLP-1s or oncology, you name it. There's a lot of categories that can be covered under the pharmacy side of the house. But one thing that we here at SmithRx want to do is we want to identify each quarter, are there any new drugs that were prescribed to your plan? Has there been any change in utilization? Has there also been any trends that we're seeing coming across the industry, such as an uptick in GLP-1 utilization for weight management? Is this normal for my population, for the size of my group, and compared to other industries across the sector? Is this normal compared to the SmithRx book of business? And at the end of the day, are there any cost containment programs through the SmithRx drug pathways engine that we can leverage to be able to bring those costs down? Again, the big key component of the SmithRx cost containment programs is that the member and the plan save at the end of the day. This is not just something to bring down the cost for the group. The member has a win every time as well. So from a savings perspective at SmithRx, we really want to highlight those big wins that came across through one of the drug pathways engine. Some of those pathways may be through grant or advocacy foundations that we help members engage in, as well as other manufacturer support that's available out in the market. We also have many programs that leverage biosimilars or lower cost options through some of our pharmacy partners. In that, we can describe to you and show to you which one of these programs has this drug and member been able to engage in to drive down to the lowest net cost, breaking down by drug, by the savings amount, and which program the member engaged in.
Jordan, this reporting is great. Can you help the group understand, is this provided quarterly? Do they have ongoing access? What does it look like for a benefit leader to be able to see this data?
We're big believers that this data and all of these reports need to be at your fingertips in real time. So at SmithRx, we have a partner portal where you can log on at midnight if you want to check the status of your savings, to check the status of your projected rebates, to check the status of any high cost claimants. This is all available at your fingertips through the SmithRx partner portal. But from the SmithRx side, we also recognize that we may have an eye on future trends or things that are coming down the market. So we would like to meet with you once you go live with us on a weekly basis to ensure that any individuals that are engaged in cost containment programs are being successful in realizing that $0 copay on their end and that the plan is saving it at the end of the day. And then quarterly, we want to meet together to review this data. So to understand what was your net PMPM, how much did the cost containment measures impact that, as well as the rebates, to really drive down to that lowest net cost for the plan. So when we talk about these cost containment programs, we want to be able to understand what was the impact of members moving to a biosimilar product or switching pharmacies to be able to leverage a lower cost. We at SmithRx really do our best to be able to put this, not only this data at your fingertips, but also project out what's the impact going to be on an annual basis, as well as what's the expected annualized savings of each of these cost containment programs. So I'm going to hand it off here shortly to Alyssa to touch base a little bit more on some of these pathways that we have on the weight management side of the house.
I'm sure it's no surprise to you all that GLP-1s are a big spend and of utmost concern for most employers. It's hard to do one of these webinars without talking about GLP-1s. Biosimilars kind of the other buzzword too, but that one is for good reason because it's driving down costs. The thing about GLP-1s is we're getting more drugs in the pipeline and also more FDA approved indications. And so we know they're expensive. We know they're popular. We know this is actually a factor for employees in seeking who they want to work for, to look at for some employees if they want to make sure they have weight loss coverage. This is a reason to stay or switch jobs for them. It's very top of mind, and I'm sure you all get asked it a lot. I hear it again and again that HR benefit leaders, both during the recruiting process and once someone is hired, they have the most conversations with their employees about the GLP-1 products, just in no way like has ever been the case with other drugs. And so you're probably having these conversations too. If you aren't covering these products today, you're probably curious. So we want to take a minute to go through what it looks like to have a robust and comprehensive program along with our drug pathways engine. And so the way the weight management program works at SmithRx is we have enhanced criteria to first make sure that the right people get the drug. And this is based on not just BMI, but also comorbidities and is more of a risk-based criteria. And then we also have pharmacy partners who can source the product at lower costs. And so we make sure that we are giving the right patients the drug and that the plan is getting the lowest cost possible. And the last thing we do, and this is really important, is we have 9AM Health as a vendor partner. If you didn't see our last full disclosure webinar on GLP-1s, it's worth a watch. Their Chief Medical Officer, Dr. Avantika Waring, is on and talks through their clinical protocols and pathways and all of their strategies in detail. And what's really great is it's not just all about GLP-1s. There's a lot of ways to help people with lifestyle modifications and lose weight. And so that's really what the program is based on. And so while GLP-1s are a part of it, we make sure to contain the cost there. But it really is a valuable program for all, whether they go on a GLP-1 or not. And through this program, only 30 to 40% of people actually end up going on a GLP-1 for weight loss, which is much lower than the industry average of 80 to 90%. So very exciting. Of course, we'd love to offer this to you through SmithRx. But some questions to ask your existing PBM is, what PA criteria do they use to decide who gets a GLP-1? What is the price after rebates and all the discounts, so you know what the real drug price is? And then consider a vendor. It's one thing to look at PA requests and criteria in a snapshot, but it's quite another to have ongoing support, because obesity really is a lifelong illness, and having a good weight loss telehealth vendor with providers and coaching and things beyond just GLP-1 prescribing is really important. Another example is our biosimilars. So a couple years ago, biosimilars got released for Humira, and then just this year we got biosimilars for Stelara. They're both injectable products for autoimmune diseases. And this is the example I gave earlier. That was a per dose example. This is the annual cost. And so filling brand Stelara, the sticker price is around $172,000. This is all before rebates and other discounts. So the price you're getting is probably different, but again, it depends on whether or not you're getting all the rebates. Well, for this product, there are a lot of biosimilars available and also interchangeable ones. So we make sure that the member has access to that and to let the provider know what the options are, including the right place to fill it. And this is where this blue pillar comes in, where it really does make a difference. The same drug can cost very different at varying pharmacies. And so we have partners through Cost Plus Drugs and Costco Specialty Pharmacy. We do not own a pharmacy ourselves. Instead, we find partners who are very good at finding very low-cost drugs, and we contract with them. And then at the end of the day, what this does is take a drug that would have been $172,000 annually with a specialty copay down to $6,600 annually. And it's not pictured here, but this is a scenario where, like Jordan said, we want to make it as easy as possible for the member, so the member has a $0 copay. So this is definitely a win-win for everyone, because it improves access and dramatically lowers costs for the plan. The biosimilars have been quite their own buzzword. There are a lot available. Some have different prices. Some are private label. But the thing is, the industry as a whole is really only switching 40 to 50% of people to a biosimilar. The difference with a modern PBM like SmithRx is we not only have the lower cost products available, but we execute on it. And we have moved over 80% of our members on Stelara over to the biosimilar Otulfi, which is dramatic savings for every single employer with a member on Stelara. And so this is also an important takeaway question. While your PBM may offer biosimilars, it's important to ask what are the actual conversion rates to a biosimilar to understand how many members in your population are getting switched and getting access to these really clinically effective, very similar products that are at a much lower cost. In looking for other opportunities, you really want to be able to understand your own data. Going between different plans, it could depend on what kind of drug mix you have, or maybe you have a certain high cost product. And so this could vary based on all of that. And so Jordan has some important takeaways for you to discuss this with your PBM.
Thanks, Alyssa. So at the end of the day, what are the questions you should be asking? First and foremost, we want to drive down to that lowest common denominator across all books of business. And that's the per member per month spend. That's the number you need to ask your current PBM. What is my current per member per month spend that we're paying on the pharmacy side of the house? You want that number to be inclusive of any admin fees. You want it to also to take into account any rebates or any cost containment measures that they may have engaged into, so that you can truly understand how much are you paying on a per member per month basis. That's the most important number. From there, you want to look at your cost drivers, right? Looking at those highest cost drugs on your plan and asking your PBM, are we currently engaging in the best cost containment measures that are out there? Potentially that could include one of many programs or many routing opportunities that Alyssa's already alluded to earlier. And then identify, how do we make this a win for the member and the plan to ensure that they're filling the right drug at the right place? And lastly, if there's an untapped opportunity, you want to make sure you're engaging that opportunity, such as leveraging a biosimilar or leveraging a patient assistance program. There are multiple avenues to be able to help out your members as well as your plan on the cost containment side of the house. At the end of the day, your goal is to know your data. This is your plan. It's your data. And we believe that that's the case, that you should have visibility into that. We would definitely recommend and encourage you to work with a transparent provider, but also one who's going to be a partner to you and hold your hand throughout the process of being self-funded. There can be questions and confusion in the industry. It can be very opaque, but we here at SmithRx want to take the confusion out of it. We want to provide you with the data and the transparency and visibility into each of your cost containment drivers, as well as to how you're performing.
Thanks so much for joining us today, Jordan. We do have time for a few questions. The first one is, speaking of data, what level of detail should I be looking for in my claims reports? This is from someone who already gets aggregated rates, but in switching over to claims level, what level of detail should they be looking for?
Yeah, well, first and foremost, that's great that you're asking that question, because that's the first step, is what is in going into my claims first and foremost. So you want to ask questions about what are the specific cost drivers, right? So how much did our plan pay for a specific drug? What was the member's cost share? Were there any cost containment drivers that were engaged to help bring that member cost as well as the plan cost down?
Great. This one is regarding contracts, which is a nice lead into our next episode. So tune in there. But the details on the data I'd received from my PBM aren't clear in my contract. Is it too late to ask?
Never too late to ask. I would highly recommend that you reach out and ask about specifics. You don't know what you don't know. So asking the question and asking them to provide it to you in layman's terms. What does this mean for my plan and for our benefit? You really want to be aligned with your PBM to make sure that they're advocating for you on multiple levels.
And then in terms of regulatory compliance, this question is around CAA compliance. How do I know if my PBM is actually CAA compliant? What's the minimum requirement on the data I'm supposed to receive? And maybe you just want to give a brief overview of CAA.
It's a great question. So the Consolidated Appropriations Act is a really important reporting component when it comes to plan sponsors and being able to report their data. Engaging with a PBM who's willing to be your partner through that, and even able to submit that reporting on your behalf is ideal. We here at SmithRx do that for all of our clients as a standard. There's no additional fee to that. That's our role as your PBM, is to ensure that you are meeting all of the regulations and guidelines that are out there.
Great. That is all we have time for today, but we definitely want to give you an idea of what's next. Speaking of contracts, our next episode will be about taking control of your contract, and we will be releasing more details soon. Our episode today just scratched the surface, and we really want to dive deeper in our next episode. And if you have additional questions, we have an email address for this program. It's called fulldisclosure@smithrx.com. And we also would love for you to connect with us on LinkedIn, as we provide updates regarding our webinars, blog posts, and other exciting things there that can help keep you informed and educated and empowered as you make choices around your benefits. Thank you for joining today, Jordan. Really appreciate you coming to be our guest.
Wonderful to be here. Thanks for everybody's time.